Now, there are several hypotheses attempting to explain the potential mechanisms by which PFO could lead to migraine attacks. The first is the chemical bypass theory. Normally, the lungs will filter out certain chemicals from the blood. However, in patients with PFO, some blood can bypass the lungs. We can avoid going into the pulmonary artery, right? So blood goes from the right atrium to the right ventricle, into the pulmonary artery, into the lungs, gets oxygenated, and goes back through the pulmonary veins here into the left atrium. Now, certain chemicals in our venous system can avoid the lungs entirely, so the lungs will not be able to process certain chemicals in patients with PFO. So if we have blood that bypasses the lungs and goes directly into the left atrium, substances like serotonin, for example, can reach the brain in higher concentrations. And these substances can then trigger migraine attacks in susceptible individuals just by not entering the lungs, by avoiding the lungs. There are an increase of certain substances that can go into the brain and trigger a migraine attack. A second theory involves microemboli and cortical spreading depression. Now let's erase some of this here. Now this is a complex process where tiny blood clots can then pass through the patent foramen ovale. So they go from the venous to the arterial system. Now, again, these aren't emboli, but microemboli. And these microemboli can cause small areas of reduced blood flow in the brain, because eventually we want arterial blood to enter the brain. And so we have these microemboli going into systemic circulation, going to the brain, and possibly resulting in localized tissue hypoxia, decreased O2 in very, very small areas of the brain. Low oxygen in certain areas of the brain, not enough to cause a stroke, not enough to result in an ischemic stroke, but enough to trigger something we call cortical spreading depression. And I have a video on that if you'd like to understand what that is. And then cortical spreading depression, which is basically just a wave of neuronal glial depolarization, is believed to be the underlying mechanism for migraine with aura. So it makes sense because PFO is seen more, there's a higher prevalence in people with migraine with aura. And this phenomenon can then activate the trigeminal vascular system, resulting in migraine pain as well. Now, a third theory is chronic hypoxemia. A PFO can cause a general decrease in blood oxygen level because we are mixing deoxygenated right atrial blood with oxygenated blood. Deoxygenated blood from venous circulation with oxygenated blood that will go into arterial circulation. This decrease in oxygen may possibly make the brain more susceptible to migraine attacks.